We're teenagers, like we get to do all the things that teenagers, you always wanted to do in your teenagers years, but you've got no, you don't have to come home by a certain time. You can drive a car. You're not going to get pregnant. And, you can enjoy all sorts of things. You don't have to work. That's another thing. You sleep as much as you like. So I think there's lots of people out there now that are enjoying life and are enjoying like all facets of their relationships together. The reason for that too is because the doctors look after us so well with health, and so of course you want that part of your relationship as well.
I'm Lyall. I'll be 72 in a month's time. I was a school teacher for over 40 years.
I'm Jeanie. We have 4 sons. We have 13 grandchildren, and I'm also involved in our church and in Scouts. I'm also a music teacher and a writer. I turned 70 last October.
We've been married for 49, nearly 49 and a half, 50 years comes up in August.
Our generation was brought up not to talk about sex. I've had the same doctor now for maybe 30 years. She's older than me, but I can't imagine talking about sex to her. And there's been times when I've really wanted to talk about these things and I haven't known who to go to or, what to say to them.
I'm not, I suppose, an open person. That's why I find it difficult talking to them about it.
Having pap smears has been really bad since I've got older. It's more about intimacy that's the problem. It's really hard to go and talk to them about that. The worst experience we've had, and both of us have had, is Lyall had prostate cancer a few years ago. And wanting to know what was going to happen after that and whether we could still have sex or not, basically, was a real issue. And there didn't seem to be anybody to talk to. When he actually had the cancer, he had erection problems. And I used to say to him, ask the doctor about it when you go to the urologist.
And he did prescribe me Viagra. Yeah, got it right. To help me. But beyond that, sort of there really wasn't any other assistance.
We didn't get much help from the doctor at all. He said, there's a few options, you can use, but they didn't sound good.
My feeling is that what they're concerned about is solving, when I say the physical, and once they've done that, then that's it. So it was almost a case of, sort of, if you asked, what, you've got to realise what's happened to you, what do you expect? And, so there wasn't really that much help at that stage.
There was no idea of counselling. It was almost like your age, it's not really an issue. That was just so devastating for both of us, really, because it's really important for us and has always been. It is one of those things that in your relationship and in our marriage that's sort of made us really strong and loving and, kept us together and through some really hard times, over the 50 years. And it was sort of dismissed, I had a conversation, there was a really nice man we knew, and when Lyall first was diagnosed with the cancer, I was absolutely terrified, really, like almost petrified with fear about what was going to happen. And this man said, he's going to be all right, it's okay, I've had it and I've had the surgery and it's all okay. And he said, of course, it's the end of your love life. And then he said, but my wife shut up shop years ago And I kept saying to Lyall, I'm not shutting up shop. Right? We have to work this out.
I asked him when I went back after that, about having, sex, and he said, you'll just be firing blanks. The nurse, the sort of, once he'd done his work, that sort of, she looked after you and everything else, and she talked about buying basically a sex toy. And basically it was like a pump, I suppose, it was to help you to get erections. So I used that for quite a while after the surgery, and now it's sitting in the bottom of the wardrobe.
I found a book on the internet eventually, which was very helpful. But as for the doctors, it was almost like, well, that's sort of finished for you anyway, and it's not.
But with the Viagra, we found after, when I say not after a time, but along the way, that I didn't need it. So we've still got some. It sort of doesn't come, when I say naturally, I think I might get orgasm. Other times I don't. And it depends, I think, a lot of being tired or perhaps, having had wine before or anything like that. So sometimes I do, sometimes I don't.
I have had 2 hip replacements, and trying to have sex after hip replacements is another thing. Like, they tell you, when you're allowed to drive a car, but they don't tell you when you're allowed to have sex, which seems a bit strange, because you would think that, it's far more dangerous to your hip to have sex than to drive a car. And maybe, they don't feel like bringing it up with people our age because that might embarrass those people. I'm not sure. Yeah, maybe we're just beyond the point of embarrassment. So, because of my hip problems, I reached a point where I just couldn't do it normally. My back was in so much pain and I didn't know what to do. And so I Googled it and found some good information about how to make love without stressing your back.
Yeah, I think there's probably, needs to be a realisation that, to some people, sex and intimacy is still important, even, as the body changes. I think that's probably where I think the difficulty is. The doctors look at it from the clinical perspective, but don't look at, when I say perhaps the whole person or the whole experience, more than just surgically or physically treating the problem.
I think they could support women through menopause better, and not by giving hormones necessarily, by finding other ways of doing it. One of the biggest problems in menopause is that you just get dry, and that's a really difficult time. For a while we had to use lubricants basically because I was just so dry, but once the menopause was over again it seemed to correct itself, and so it's fine now. Who would have thought? I thought I was like it for the rest of my life, and it turned out I wasn't.
We still love each other, and Jeanie keeps saying to me, "Oh, you're the best lover in the world." We've been, faithful to each other for 50 years, and we do a lot of things together, and I think we're probably best friends. Jeanie used to say to me when I was teaching. And the students would sort of say, oh, was that your wife that picked you up? And she said, oh, you ought to tell them, oh no, it's your mistress or your girlfriend. And I mean, the bottom line was that, you could describe Jeanie in all of those ways. That, she's still my wife and lover. You know, we've really enjoyed it. We do enjoy it. Yeah, sometimes the erection will eventually come, but the sort of the orgasm may not. But that's all right. We've that when I say it doesn't worry us, it's good when it does happen. It's good for each of us, but that's not the be all and the end all.
I want to encourage other people to be couples still as they get older, and not to think that it's over. You know, between my mobility problems over the years and Lyall's problem, with the prostate, it's been a challenge to keep going at times, but there is very little help around for older people, really. I don't know whether any GPs are equipped for it. I had to search for this book, and it was about post-prostate surgery and intimacy. I think that's what it's called, something like that. I think it should be in all urologists' waiting rooms, basically.
The important thing is that doctors and medical, certainly aged care people, need to realise that there are people who are still intimate together and having sex together and enjoying it and enjoying each other.
I think they could bring it up to start off with, rather than waiting for you. I think they need to acknowledge that older people still enjoy a love life, and that it's important to them in their relationship, and that it draws them together and probably keeps them healthy too. And it's probably not important to every couple, but maybe to understand that for some people it is, and that as you get older and the limitations of your body catch up with you, that it would be really nice to have some ways of making love, within those limitations. And
my view is we'll keep going, as long as we both can. If we've got to find some other way or whatever else, well then, we'll explore that.